This is Dr. Lahari from Leo Dental, Bangalore. Something which will inhibit you from socializing with people, something will stop you from smiling, something that will stop you from approaching people, something that will underrate your confidence and sit in your brain and pester you forever and make you very underconfident is your bad breath. Surprisingly, bad breath is seen in 60 to 65% of the population, but only some people acknowledge the problem of bad breath. Most of the times, we have to know that we have a bad breath only from the others telling us, and bad breath have been surveyed extensively and has been declared as one of the most important key factors that determine in intimacy and determining the relationships and determining the friendly status of the people. Surprisingly, in India, most of the studies and most of the research have been concentrated on other topics than small topics, rather important topics that affect us on every day. Imagine having a bad breath. It affects you from the time you wake up to the time you sleep, and it will disturb your mental peace and affects all your social relationships. When you doubt that you have a bad breath, acknowledge the problem. Try to diagnose why you have a bad breath. Try to analyze what will be the treatment or the healing therapy to fight your bad breath, and do the needful before it damages you in an all-around way. Generally speaking, bad breath can be due to two factors. They are local factors and the systemic factors. Coming to the local factors, that is the factors that are concerning your mouth. What situation in your mouth can lead to bad breath? Extensive dental caries or the cavities which are untreated, extensive calicular stains, deposits and debris, food impaction. People have lot of spaces in their mouth where food goes and sits for more than 6 hours. It starts rotting there and it will give rise to bad breath. Sometimes dehydration, not taking water or fluids for a lot of time, and irrelevant or uncoordinated eating habits, all these are local factors that can lead to bad breath. One very important factor very recently added is due to this COVID situation. We are already covering our mouths and we are taking a breath with your mouth along with your nose. All these factors add up, and if you have an inherent infection in your mouth in the form of cavities, gum problems or dehydration, or are not having a healthy tissue in your mouth, then your mouth is definitely supposed to stink and you suffer the problem of bad breath, which is called halitosis in our dental literature. Some patients with a proper oral health, clean mouth do have bad breath. That time systemic factors will be taken into account. Diabetic people with a poor diabetic control have a ketotic breath or a fruity odor. When you talk to them, you feel the smell of a rotten fruit. That is because of their poor diabetic maintenance. People who are on asthmatic drugs, who are using oral inhalers, they tend to have other type of breath. And people who have severe gastric irritation or GERD, gastroesophageal reflux disease, they tend to have a severe bad breath irrespective of having a clean mouth. You have to analyze whether your bad breath is caused by local factors or systemic factors. If your bad breath is covered by local factors, it is very easy to fight the bad breath. Just see a dentist. Tell them that you have a bad breath. He will suggest, or the doctor will suggest you to go for scaling, mouth cleaning, rinsing, and the necessary cavities that to be attended, or if there is any pus in your mouth, that will also be taken care of. And they keep you on a supportive treatment like mouth washes, salivating lozenges, and mouth rinsing gels. Recently, dental treatments have also introduced mouth freshening sprays that will actually increase your mouth saliva levels and keep your mouth free of bad breath. Once you spray it, you can remain bad breath free for the next 6 to 7 hours. Don't suffer yourself and get underconfident with a very small problem with a very easy solution. So whenever you have a doubt, consult your immediate family or the immediate friends whether they also feel that you have a bad breath. When you confirm you have a bad breath, try to analyze why you have a bad breath. Immediately see a dentist. Check what could be done at the earliest to fight your bad breath. Sometimes the underlying conditions like renal disease or diabetic disease can also be diagnosed with the smell in your mouth. Renal patients tend to have uremic breath. Recently, we have seen 6 to 7 cases within a 6-month period where we diagnosed bad breath, and when we did the renal function test, exactly the patient was having renal issues. So, bad breath can indicate so much going in your body. Don't neglect your bad breath. Take a doctor consultation, take the proper treatment, fight your bad breath, have the ultimate confidence and the best smile possible. Hope this video was useful. Thank you.